to the next session of the general surgery series. And so today's topic of my discussion will be about burns. So as to looking at the what is the actual definition of burns. So burn, it can be defined as a skin injury which can be caused either due to a thermal, chemical, or, or electricity, or due to a radiation. So students, burn is any kind of a skin injury which can occur due to thermal, chemical, or electrical, or it can occur by radiations. So students, today I'll be discussing about the different types of burns and the clinical features what are seen. So the classification I'll be emphasizing more upon. So the looking at, it's just soft tissue skin injury which can occur due to thermal. So under the category of the thermal burns, we are going to have the thermal burns can be of it can occur either due to the dry heat or it can occur due to flames. So students, the thermal burns, that is the burns which are caused by heat, it can be further subdivided into dry heat and flames. It can occur due to dry heat or due to flames. And the wet heat, the burns which are caused due to wet heat, they are known by the name of scalds. So scalds are those, the scientific term, the medical term, what is being used for the burns which are caused by a wet heat, it is called as scalds. Moving on to the next type of burn, that can be called as the chemical burn. So in cases, mostly the chemical burns what are caused, it can be seen due to an acid or due to an alkali. So whenever an acid or an alkali is injuring the skin tissue, it is actually a chemical burn. Moving on to the third important category, that is the electrical burns. So the electrical burns can be further subdivided into the high tension burns and the low tension burns. So students, the high tension burns and the low tension burns, they are the electrical burns can be classified depending upon the voltage of the electric current what the person is receiving. So if the voltage is exceeding, if the voltage is less than 1000 volts, it can be called as a low tension burn. And if the voltage is exceeding more than 1000 volts, it can be called as a high tension burns. Another kind of burns what can be seen, it can be due to the radiations. There are various kinds of harmful radiations from the sun which can cause the radiation burns. So students, the main topic what I'll be emphasizing as to what is the depth of the burns. So the depth of the burns, the formula for the depth, for the assessment of the depth of the burns, it can be looked upon as the depth of the burn is directly proportional to the temperature and the duration. So if the temperature is more, the depth of the burn will be more, and if the duration of the burn is for a longer period, obviously the depth of the burn is more. So moving on to the next important criteria, that is the depth of the burn is inversely proportional to the vascularity. So the more vascular the area, the lesser is the depth of the burn, and the lesser the vascular area, the more is the depth of the burn. So students, this was the golden formula to assess the depth of the burn and its severity. As to what severity the burn is holding, it can be looked upon by this formula, that is the depth of the burn is directly proportional to the temperature and the duration, and it is inversely proportional to the vascularity. The more the blood vasculature, the more the blood vessels in that particular area, the extent of the depth of the burn will be lesser. Now moving on to the next very important classification of the burns. So the classification of burns can be broadly categorized into 4 classes, that is the 1 degree burn, the 2 degree burn, the 3 degree burn, and the 4-degree burns. So students, before going into the much details for the 1 degree, 2 degree, 3 degree and the 4-degree burns, we should have a clear picture in our mind about the histology of the skin, the histology of the human skin. So in the skin, what we are going to find is the upper superficial layer, which is formed by the squamous epithelial cells. These are formed the epidermis. So when looking at the skin, the superficial layer which is covering the entire intact skin, it is the epidermis. Below the epidermis, we have the dermis. So this dermis can be broadly divided into the two types. That is the one which is lying just immediately below the epidermis. It is called as the papillary dermis, and the dermis which the part of the dermis which is more having reticulations, that is, it is going to have a network like formation of blood vessels. It can be called as the reticular dermis. So the in skin we have the two components, that is the epidermis, which it is the superficial outermost layer. Moving on to the next, dermis. So the dermis is it can be subdivided into the papillary dermis and the reticular dermis, and below the dermis we are going to have the hypodermis. So hypodermis basically comprises of the subcutaneous fat. All right, so this was a brief histological section of the skin. Now, depending upon the extent of the burns, up till which layer of the skin the burn is affecting, up till what layer, it can be further classified into the 1-degree burns or the superficial burns, the 2-degree burns, the 3-degree burns and the 4-degree burns. So the extent of the burn up till where it is extending, this forms the basis for the classification of the 1-degree, 2-degree, 3-degree and the 4-degree burns. So beginning with the 1-degree burns or the primary burns. So in the case of the primary burns or the 1-degree burns, what we can see is only the uppermost layer of the skin, that is the epidermis, is involved, and the skin appears very erythematous. That is, the skin is going to have a reddish appearance, and such burns are mildly painful. They are not very painful, and what we can find is on the blanch, when we are going to touch, when the skin of the patient is touched, there is some kind of a blanching occurs. So blanching phenomena is mostly seen. Blanching, there can occur blanching to touch. It means that is when the skin of the patient is palpated or it is pressed, there can occur the whitening of the skin, and within 2 seconds of removal of the pressure, the skin again becomes reddish. So this is the blanching to touch can be seen, and which clearly signifies that it is going to have a good capillary refill. So good capillary refill phenomena is mostly seen in the 1-degree burn. So the capillary refill test can be done in any body part, any area of the body part. So whenever the area what has got burned, if we are going to press that area, there can occur blanching, that is the whitishness can occur, and on removal of the pressure, again that particular area of the skin, if it again becomes red, so it indicates that the patient is having a good capillary refill, and the good capillary refill phenomena is mostly it is seen in case of 1-degree or the primary burns. One very striking and distinguishing feature of the primary burns, it is that in that it is mildly painful and there is no blister formation. So students, do remember, in case of the primary burns, there is as such no blister formation. There is only a slight reddening of the skin with mild pain can be there. So mostly such primary burns, they mostly heal within 5 to 7 days. 5 to 7 days they are going to heal. And very important thing, most patients, they were very much scared about the scar formation. So in case of if it is a primary burn, there is going to be no permanent scar formation. That is, the burn injury is going to heal without any scar formation. So examples of the primary burn comprises of the sunburn. The minor kitchen burns are mostly due to come under the category of the 1-degree burns. So looking at the treatment modalities, so what should be the treatment of such a minor or 1-degree burn? So in this condition, while looking at, just we ask the patient to immerse, to soak that body part into the cold water. So in case of 1 degree burns, the patient is asked to immerse that particular area, to soak that particular area in cold water. So that can help him to get rid of the symptoms, which can be very severe. So firstly, the first line of treatment, the first modality of the treatment, ask the patient to immediately immerse that body part or to soak that body part in cold water. Moving on to the next treatment modality, if it is a case of a minor or a 1 degree burn, antibiotic ointments are there, particularly the silver sulfadiazines or the soframycins. Particularly these antibiotic ointments are applied, and if the burn is having a mild pain, we can give acetaminophen and ibuprofen. So ibuprofen and acetaminophen are basically the non-steroidal anti-inflammatory drugs, which can be helpful in relieving the pain what is caused in cases of burns. Moving on to the next important category, the second degree burns, that is the 2 degree burns. So the chief and the distinguishing feature of the 2 degree burns, it is that in this kind of burns, they are extremely painful. Students, do remember, the 1 degree burns, they are mildly painful, whereas the 2 degree burns, they are going to have blister formation occurs. There is a blister formation, as well as these in such cases there can occur edema. The swelling can also manifest due to leakage of the plasma from the intravascular compartment to the extravascular compartment. So the most in 2 degree burns, the most distinguishing features are the blisters and swollen, and such burns, they are mostly moist. That is going to have somewhat, the surface of the burnt area will be having somewhat of a moist structure. So this 2 degree or the superficial 2nd degree burns, these are also called as the partial thickness burns. So students, as the name already suggests, that in the 2 degree burns, a part of the epidermis will be involved, and there can be involvement of either the papillary dermis, or it can extend up till the reticular dermis. So the epidermis, the entire epidermis can be involved. It can reach up till the papillary dermis layer, or it can reach up till the reticular dermis layer, but not beyond that. So such burns are mostly very painful. So moving on to the 2 degree burns, which are also called as the partial thickness burns. So students, it can be further subdivided into two broad categories, that is the superficial 2 degree burns and the deep 2 degree burns. So in case of the superficial 2 degree burns, what we find is the entire epidermis, the entire epidermis of the skin is involved, and the next, a part of the papillary dermis is involved. So in case of the superficial 2 degree burns, the entire epidermis and the papillary dermis is involved. Such burns are very painful, and there is blister formation. Students, so under the 2 degree burns, the superficial 2 degree burns, they mostly heal by 7 to 14 days of the burns, and in this also, as such, there is no scar formation on wound healing. After the healing of the burn injury, there is as such no scar formation. Moving on to the next subtype of the 2 degree burns, that is the deep 2 degree burns. As the name already itself suggests, that in this condition, the entire epidermis will be involved, the papillary dermis will be involved, and the reticular dermis also gets involved if it is a deep 2 degree burns. So in case of such patients, the clinical features what are seen, the skin of the patient appears somewhat pink or mottled pink. It means somewhere there can be pink and somewhere there can be normal color. So in deep 2 degree burns, what we are going to find is the skin of the patient is mostly pinkish appearance, or there can occur the mottled pink appearance. Moving on to the next important clinical feature, that is the 2 degree burns, they are painless, or if the pain is persisting also, the pain is quite less. The pain might be to a lesser extent as compared to the superficial burns. And the third clinical feature, when we look for the signs of this, in this the no capillary refill is seen. That is, if we are going to press that particular area, no blanching, and after 2 seconds no reddening, again a recurrence of the reddening won't occur. That is, the no capillary refill is there. And the pinprick sensation, if we are going to prick the patient by the pinprick test, so if we are going to prick the patient with the help of a pin, so there is as such no pinprick sensation. Sensation is preserved. That is, the patient is going to respond to the pin pricking. Moving on to the next, in case of the deep 2-degree burns, what we are going to find is that the deep 2-degree burns, they are going to heal by 3 to 5 weeks after the burn injury has taken place. So they take the deep 2-degree burns, they take a much longer time to heal, and they are occurring, the time duration what is seen for their healing occurs, that is 3 to 5 weeks after the deep burns. So 3 to 5 days, 3 to 5 weeks it takes for the deep 2-degree burns to heal. Moving on to the next very important clinical feature, that if it is a 2-degree deep burn, it is going to leave scar. So the scar formation after the burn injury has healed, there is a clear evident scar formation. So students, do remember that is it in the 2-degree burns, it is only in the deep 2-degree burns where the epidermis, the papillary dermis, and the part of the reticular dermis, if it is getting involved, that can ultimately lead to scar formation. So moving on to the next third type, that is the 3-degree burns. So in case of the 3-degree burns, what we are going to find is the clinical feature on seeing the patient's superficially, what we find, the skin is going to appear somewhat white or brown in color. So the skin becomes, it is no more giving a reddish appearance, nor it is a pinkish appearance. The skin becomes white, or it can turn even brown. So in case of 3-degree burns, we are going to find it whitish or brownish structure, a brownish appearance of the skin. And the 3-degree burns, they are also called as the full thickness burns. So students, do remember that the 3-degree burns, they are known by another name, that is the full thickness burns. And in this condition, the entire epidermis plus the dermis, that is the papillary and the reticular dermis both, and the whole of the subcutaneous fat, that is the entire below the hypodermis, it also gets involved. So in case of the 3-degree burns, the epidermis, the dermis, and the subcutaneous fat, that is the hypodermis, it also gets involved. So moving on to the important clinical features, the clinical findings, what we see in case of the 3-degree burns, what we have, that is, the students, do remember that if it is a 3-degree burn, it is absolutely painless, because the entire nerve supply, the nerves have been entirely damaged, and so since there is a no nerve supply, nerve endings, they are all destroyed over here. So the 3-degree burns, that is the full thickness burns, they are absolutely painless. Moving on to the next important criteria, in case of the 3-degree burns, again there is no capillary refill. The next point, that is no pinprick sensation. So if we are going to have the pinprick sensation test, the patient is not going to respond. That is, on pricking that particular site with the help of a pin, the patient, the victim of the burn, he is not going to show any signs of itch pricking. So no pinprick sensation to the patient is there. And the striking and the distinguishing feature, what needs to be very importantly remembered, it is the eschar formation, and the contractures, what are the most important clinical findings which can occur in cases of 3-degree burns. So students, eschar formation, it is, eschar is a term which is also, it signifies that it is a sloughing of the skin tissue, or it is a scab of a dry and a dead tissue which occurs after the burn injury, and ultimately the skin sloughs off. The dead tissue of the skin, it is going to slough off after healing. So this eschar formation, it is mostly seen in the 3-degree burns or the full thickness burns, and the skin is going to, in eschar formation, there is going to be a hard leathery skin appearance, which gives it a white or a brownish structure. So the in 3-degree burns, the striking distinguishing feature, it is the eschar formation. Eschar formation, that is the hard leathery sloughing of the skin after the wound has healed. It is the eschar formation, and contractures are seen. So how do we define contractures? That is, in the 3-degree burns, what we find is that contractures occurs. That is, contractures can be defined as the condition in which there is going to occur the shortening and the hardening of the muscles, tendons, or other tissues, leading to deformity and rigidity of the joints. You must have noticed in such patients, in patients who are having the 3-degree burns or the full thickness burns, in them the contractures is a very basic finding. So contractures are mostly seen and in such conditions. And contractures, how do we define contractures? That in case of contractures, it is a condition where that is going to occur the shortening after the wound, after the burn injury has healed. So after the healing of the burn injury, hello Rachit, so after the burn injury has healed, so it can occur to the shortening and the hardening of the muscles, tendons, and it can ultimately lead to the deformities of the joints, and rigidity of the joints can occur. So contractures, it is the basic phenomena, the most distinguishing features, it is mostly seen in 3-degree burns. So students, do remember the eschar formation and the contractures, it is the late manifestations, that is after the healing of the 3-degree burns. These two phenomena can be very evidently seen in patients of 3-degree burns. Moving on to the last but not the least, that is the 4-degree burns. So in cases of the 4-degree burns, what we find, that is, if it is a 4-degree burn, not only in this condition, in 4-degree burns, the entire epidermis, the dermis, that is the papillary and the reticular dermis, and the entire hypodermis, along with it, the burn injury extends to the bones, muscles, and the cartilage. And the 4-degree burns, they need treatment either by grafting or flap surgery. So in such conditions, if it is the case of a 4-degree burn, it is coming to the hospital, into the emergency department, that after that primary treatment has been carried out, they are mostly treated by doing a flap surgery or doing grafting. So in this condition, if it is the case of a 4-degree burn, what do we find is the skin of the patient, it is going to show somewhat a brown, dry, and a charred appearance. So this charred appearance, it is a charred or a painless appearance. Charred appearance of the skin can be seen. It becomes somewhat more black. Charred appearance is mostly used when the skin is going to become very dark and black, greater than brown. It is somewhat having a charred appearance. And since it is very similar to the depth of the extensiveness of the burns is so much, so in such conditions, the 4-degree burns, they are also painless. So students, this was all about the clinical features and the definition, the types of the burns, what I have discussed. In the upcoming videos, I'll be posting videos upon the extent of the Alexander's Wallace rules of burn, how Wallace has classified the severity of the burns, the percentage, how to calculate the percentage of the burns. I'll be uploading videos on it, and I'll be discussing about the treatment modalities, how the treatment procedure is done. So in the upcoming videos, I'll be also discussing about what are the most common infections which are mostly seen in the patients of burn, and what are the early causes of death, and what are the late causes of death in a burn patients. So students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated about my newer videos. Thank you for watching.